Hey guys, it's Thursday, August 13th, about noon. Uh, Suzy's back in the hospital, and I'll give you an update about that and tell you how that came about and what's happened since then, and issues that I have about doubting myself and decisions that I'm making on her behalf. So anyway, I'm back to some notes to keep me on track. Last video I did was last Friday night, describing me trying to get somebody on the phone that I could really have a conversation with about Suzy's condition and get some action taken short of taking her to the ER. And basically what I was being told by a variety of people that were responding via text in their app is take her to the ER. And I'd say this variety of people were not nurses or doctors. There was one doctor and one nurse, and both of them suggested ER, but they weren't really addressing the questions and what I was seeing. It was just like, we'll take her to the ER. And I understand this on some level. That's the safe decision. You never go wrong as a physician or a nurse telling somebody to go to the ER if there's a question on their vitality or health vitality or whatever they call it. But I was trying to prevent that. In other words, going from a hangnail to a foot amputation, there have to be some steps in between. And I just felt that those steps weren't being taken. And again, I'm totally naive. I don't know what those steps would be, but I just don't think that going from me describing the situation to jumping to the ER is necessarily the answer. At least that's how I felt Friday. One of their suggestions was for me to call an advice nurse. I'd have no idea what that is at the time. And I thought, well, how is this nurse different than the nurse that comes to my house and actually sees Suzy and sees the cloudy urine and sees all this stuff? And I admit I was naive. I should have embraced that more quickly. And I should have not relied on the home health care people to be communicating. I needed to be up front and center communicating to the doctor, and not assume that either the home health care people were communicating or that their message was being received and considered, So anyway, that's part of my learning. So from Friday to Saturday morning, Suzy's not eating during this time. She hasn't eaten since Tuesday noon. So Saturday morning, I say to Suzy, listen, if you're not going to eat, I need to take you into the ER. And, she's gone through 2 bouts of extended not eating since she's been home. There was one where it was going on her 8th day, which was right around the time that I got her on the antidepressants, which were also supposed to enhance her appetite. And she did start eating on the 8th day. And so that went on for about a week. And then last Tuesday, August 4th, she stopped eating that evening. And I asked her, I said, are you experiencing abdominal distress? Is that why you're not eating? And she shook her head, yes. Now, I always have a question. Is she really understanding me clearly? And is she able to communicate, even though it's through a head nod, that I'm asking the right question? So that I don't have a lot of confidence in. both myself and her getting it. And I think she gets a lot, but I don't know on some of these things. So anyway, Saturday morning, I say, listen, I'm going to have to take you in unless you start eating. So she agreed to eat, and she had half of a small banana sliced. That was it. Then for lunch, it was a little bit more. It was like potatoes and, I think potatoes and rice. I forget exactly. Potatoes and chicken, something like that. Not a lot, but she didn't eat much. You know, it's like I gave her half a potato and I think some it was turkey meatball. Gave her half a potato and turkey meatball, and she ate about half of that. So essentially, a quarter of a potato. Dinner, she had homemade tomato soup with rice. So she was increasing what she was eating as we went along, but still, in my opinion, not enough to make up for lost ground that she has had in the past by not eating. And all this time, she still has the cloudy urine. Monday, I get a phone call that I'm not able to take because I'm changing Suzy's diaper from an advice nurse. I was pretty busy that day and didn't call her back. And again, I was skeptical, like, what good is this going to do? Tuesday, I have a conversation with the OT, which I think is a really level-headed, practical person. And even though her background is occupational therapy, she has some really good suggestions on how to deal with this. And she strongly recommended that I do speak with the advice nurse. And so I did speak with the advice nurse. The advice nurse did follow up on Tuesday with a phone call, and I answered, and we had a very good conversation. And the advice nurse essentially was saying, listen, sounds like she still has an infection. This is probably what needs to happen. Probably she needs to have some antibiotics immediately because whatever she had before didn't do the job. And in the interim, it's going to take a day or two to get a culture back regarding what she actually has in terms of bacteria. So I said, okay, that was kind of my thinking. And what the advice nurse does is the next step is to set you up with a telemedicine call with a doctor, which she did. And that was a couple hours after that at 5:30 in the evening. So I'm talking with this doctor, and the doctor essentially has 15 minutes scheduled. Essentially, she hasn't read anything that I've sent in the past. So she has, from my perspective, very limited perspective on this, and she's trying to pin this down to like one or two things. And I said, listen, it's a constellation of issues that I think some of them are related, like I think the fact that I think she has an unresolved UTI is affecting appetite, affecting behavior, other things. It could also be affecting this loose stool situation. I have no idea. And so I told her she was going to have Suzy was going to have her Foley catheter changed this coming Friday, and meaning tomorrow. And so the doctor said, listen, I don't want to order anything until that catheter gets changed. Catheter line could be dirty in terms of bacteria, and that would give us a false positive. So I want to make sure that we're really dealing with the real issue, okay? And I accepted that, and after I got off the phone, I was kicking myself because I really felt that waiting till Friday, from Tuesday to Friday, was too much. And she'd been waiting for weeks, and I strongly feel she had this UTI at least as far back as July 20th. July 20th was her first doctor visit. The doctor didn't do any kind of examination. It was basically conversation with me and Suzy. He did say he wanted to run some tests, and later on the nurse said he reconsidered that because the hospital had done some tests and those were relatively recent. So I thought, okay, that makes sense. I don't want to be testing all the time. But this is the thing that's confusing to me. You've got the power of observation. Suzy had a bladder bag on her at the time. It was an ankle bag, so it doesn't hold much urine. But I drained that at their office in the bathroom. They gave me a container to put it in. I photographed it. The doctor's on to other patients by that time, but I'm just thinking in retrospect, why wouldn't you even be taking a look at that? I mean, that's an indicator of something, maybe, maybe not. Anyway, later that day, I'm noticing her catheter line, and it looks like there's blood in it, at least particulate matter that looks like blood. And I showed that to the home health care nurse the following day. And, again, I'm assuming all this is getting reported and the doctor's aware of it, but they're not doing anything. So I should have been after them. That's part of my learning. So anyway, fast forward to Saturday, she starts eating again. I get to Tuesday, and Tuesday evening, she's not wanting to eat much. Like, she had a couple bites and that was it. Oh, the doctor also said about the loose stool, I should be giving her Pepto-Bismol. So I started that. Only gave her 1 tablespoon. My priority is make sure she's eating and taking meds, and then secondarily the Pepto. And then the following morning, Tuesday, she only had 3 bites of oatmeal and didn't want to eat anymore, and she was drinking about half of the normal fluids. She took all her meds, and I'm just thinking, this cannot continue this way. This is not going to work. And so I did get a hold of an advice nurse. It was a different one, ran through all the history. I feel like I repeat this history every time, and it's a long, convoluted story that I think it's like TMI, too much information, but, I don't know what's important and what isn't. I don't want to leave out something that could potentially be important. So anyway, he concludes, yeah, you really should go to the ER. And that's kind of what I was thinking at the time. And I told Suzy, we're going to go to the hospital, and she was not happy. And Suzy will say words repeatedly, and one word that she repeats, I think, when she's particularly agitated. She does it a lot when I'm changing her diaper, because that's not a pleasant thing for her, me doing all the cleaning and stuff. And so the word is why. Why? She's continually saying why. And it really doesn't matter my answer. I don't even think I should be trying to answer it, because I don't think that's what her intention is. She's intending to say a word, and I can sense she's frustrated, and the word that's coming out is why. So anyway, we conclude the phone call about 11:30. I'm trying to get things organized in the house to take her. I haven't had her in the wheelchair for 2 weeks. I'm concerned about getting her in my car because, I'm not supposed to be transporting her and all that other BS. And, I'm watching my little videos that I've taken of the OTs and the PTs showing me how to move her from the bed to the chair and the chair to the car and vice versa. And, trying to get myself mentally ready to do all the steps and stuff. And so before I'm going to do all that, I think, well, I better check her diaper again. So I check her diaper usually like between 7:30 in the morning. That's the first thing. Usually it's soiled. Clean her up, change the diaper, give her her thyroid, and then 30 minutes of nothing. She can't have anything. And then after that, she takes some more meds, breakfast if she's eating it, plus liquids. And then in about 2 to 3 hours, I'm checking the diaper for bowel movement. So this was a little longer than 3 hours since I changed her diaper, but she had a huge bowel movement. It was a huge mess. This was around noon, so that took me a while to clean up. And, kind of an interesting aside, I've I told you earlier on another video that the home healthcare aide that gives her the sponge bath, Alexandra, she was very instructive to me because I really watched how she was cleaning her anus and genital area and how thorough yet, firm and gentle, that kind of thing. So it gave me a better awareness of what to do, how to do it, and to what degree to do it. And so every time I clean her, I'm using like this special soap that you don't have to rinse. It's a spray-on or a foam pump kind of thing that I'm either putting on her or putting on her on the wipe. And, I'm getting every speck of feces off of every part of her, I think. At least all that I can inspect. And, I'm cleaning around the catheter line with this soap and wipes. And then finally I'll take a wipe and put alcohol in it and really clean the line from the base of the line going into her all the way up to an attachment point on her leg. So that's kind of been my routine. And so in the hospital yesterday, I'm seeing them clean her, and they aren't doing the job that I'm doing. They're not using any of the spray-on soaps or any of that stuff. They're using wipes, and they're wiping, I think, pretty thoroughly. And I think most of the feces is still pretty wet, so nothing dried on. So, but I'm telling them, I'm telling them, hey, I think she's due for a diaper change. And they're asking me how many times a day am I doing this, and I'm saying at least 4 to 5 times. So in that respect, I am anal, pun intended, in terms of her cleaning. Let's see. So anyway, I cleaned Suzy before going to the ER, and so by the time we get to the ER, it's 2:00. And, when I'm on the phone with the advice nurse, I'm saying, I've got a question for you. It's a non-medical question. I'm really concerned about it. And basically my question is, I'm driving her there. Suzy has no ability to speak. She has aphasia. What am I doing with my car? How am I getting her into the ER? All those mechanics, like how does that all work? And so the advice nurse was very helpful. They have a valet there that'll, basically free valet. They'll park your car. They'll, keep track of things. They get your cell number. They text you. You text them when you're ready to leave. So that was a big relief to me. And the advice nurse said, go into the ER and say, I need help to bring my wife in. She needs a wheelchair. And so I did that. I was thinking, do I take my wheelchair? And I'm concerned about it getting lost. And I did put a luggage tag on it. But again, that's not fail-safe. So was able to get a wheelchair from the hospital. And somebody came out and helped me. Big help. But, in the ER, this is a Wednesday at about 2:00. So we were in the ER for about 3.5 hours before Suzy got into a room. Now, things are happening during that 3.5 hours, but not much. Most of it's just sitting and waiting. And Suzy's very upset and very agitated, and she's saying why very loudly. People around can hear her saying this, why. Now, it's not all the time, but it is frequent, okay? And during that waiting period, we're talking with somebody behind a window. They're taking all our information. Then I'm waiting 30 to 45 minutes, and there's another somebody that is, I guess it's registration, and she's asking the same kind of questions. It just seems like I keep repeating the same questions over and over and over, same answers over and over again. I'm not sure what the logic behind that is. Maybe you come up with something you haven't said before. Maybe you omit something you've said before, I don't know. So anyway, we kind of move through the space, and we get to another section where there's a bunch of people waiting. And we're waiting about 30 minutes, and somebody calls Suzy's name. I respond, and so they want to get a urine sample out of her urine bag. And, what I've been told is it's only good for 3 hours, and, ideally, once you collect it, you want it refrigerated. So I'm telling this person, listen, I put this catheter bag on 3 hours ago or 4 hours ago, whatever it is. Aren't you at your limit? It's been room temperature, blah, blah, blah. She says, no, we'll just take a sample. And they also took her blood, took some blood samples. So did that, went back to the waiting room and sat for a while. And then somebody comes out of the actual ER, where they have doctors and nurses and beds and rooms and such, and took us in. And we get to a room that's a shared room with about 5 other beds. I think half of them are used. I'm forgetting the sequence, but basically I was told that they were going to give her a antibiotic via IV because her labs did come back and showed that she was infected. And I did speak with the doctor after being there for, 30, 45 minutes, who I really like this doctor. And, I take a picture of every bowel movement, every urine draw, and several times a day I'm showing the clear tubing with the urine in it showing either cloudiness or sedimentation or whatever. And so I'm showing this to the doctor, the urine, and she's going, yeah, that one looks like, that's definitely cloudy. That looks like a hazy IPA. So I had a doctor that was a beer aficionado. Anyway, she said the labs came back on her blood work showing elevated enzymes for the liver, and that she would like to admit Suzy. Basically I had told her Suzy's history of not liking doctors or hospitals, and I said, listen, let's get this taken care of. I told her my concerns about her not eating. I had a list of goals for the hospital when we went. One of my goals was to get a Foley catheter changed out at that time. Another one was for me to get Suzy's current weight. Another one was to check for bed sores, because even though I see her body a lot, most parts of it, I'm not trained in this. So anyway, so that was a thing I wanted done. There were a few other things I don't recall right now, but I think most of them got done yesterday. So anyway, doctor wanted to admit Suzy. I said, fine. So they had her get a ultrasound on her liver, kidney, pancreas. That was not conclusive in terms of anything being wrong. I mean, the report said unremarkable, and if it's unremarkable, that means can't find anything bad. So I guess it's good to be unremarkable sometimes. So anyway, we're in the ER. It's getting late. It's 10:30. I am just like dozing off. I'm tired. Suzy's tired, I know. But, it's all lit up. It's not like a dark hospital room. And so finally, I don't know what time it was. Maybe it was 11:30. We get up. They get her a room in another part of the hospital. And, it takes a while for all this to happen. So she's going to the floor is called 2. It's the number 2 surgical. And I don't know why they call it too surgical. I mean, initially I'm thinking, surgical. I don't know about her having surgery. No, she's not having surgery. So anyway, we go to 2 surgical. She gets a room, shared room with another woman. Basically, I'm going through Suzy's history. I'm showing photographs of her poop, and it's been loose for 30 days, and I guess they're giving this feedback to the doctor. I'm not seeing the doctor somehow. I guess they're doing it through their information technology system. And so the doctor then is recommending Suzy be in her own room, isolated from other patients until they get a better handle on what's going on with her feces, bowel movements, whatever, why it's loose, and how to deal with that. What else? Let me see my notes. While we were waiting, this 3.5 hour wait in the ER to get even to a room, I'm questioning, this is a long wait, and I'm questioning whether this was a good idea, and it's such a pain in the ass. But, emergency rooms, they can't predict what the demand is at any one time. So I'm questioning it, and then once we start getting the blood results, like the elevated liver enzymes and some of these other things, I think, okay, that was the right decision. And also the urinalysis results showing that she still was infected. In terms of her weight, when she checked in at the beginning of her hospital journey on June 13th, that's when she was originally admitted, she weighed 98 pounds. Now, how are they weighing her? They have a bed that basically, I guess you zero out the bed, and then once you put the person in there, it's whatever additional weight is there. The bed says this is what they weigh. So at that time, that calculated that she weighed 98 pounds. And I'm telling the nurses last night, I'm saying she's had several bouts where she hasn't eaten for several days. I'm thinking she has to be under 90 pounds, And so they weighed her, and don't take this number as the gospel, but it's in the ballpark, that she weighs 85 pounds. Okay. So that's a 13% weight loss for somebody that doesn't have much weight in a 2-month period. And that really, really, really concerns me, because I feel like she doesn't have much reserve if she hits a major bump in the road. Maybe we have hit a major bump in the road here, and we need to figure it out. So anyway, that's been kind of my journey and Suzy's journey. My goal today was to get there much earlier. It's now about 12:30. I'm going to be leaving shortly. Hopefully I'll be able to get up to speed. I am taking some stuff to trim and file her nails. She hasn't had that done since she was hospitalized 2 months ago, and her nails are getting quite long, and it's difficult to get the blood oxygen reading when they put those little oximeter clips on. I've got one, I bought one, and I don't think I was getting an accurate reading. So that's an action item. I mean, that's something I can do while she's in the hospital. So I've clippers, nail file. I've got a little container to put her fingers in, warm water, and taking some soap to kind of soak things and soften them up and clean under her nails and all that kind of stuff. I stripped her bed here at home, and basically I'm going to launder those sheets and put on fresh laundered linens. And I thought, it would be cool if I could give her a bath at the hospital, sponge bath at the hospital. prior to discharge, and I don't know when discharge is. So I'm taking materials, and hopefully they'll be cool with me doing that. I don't see why they wouldn't. What else? Oh, just little things that I've been wanting to do but haven't, because I thought it would be disturbing to Suzy. So on this hospital bed, it can raise and lower probably about a foot differential, and you really can't tell where you are on that bed leg, in terms of how much more to go. So I painted some little white spray paint markers for reference points, just to let me know how close I am to up or down, because it's a brown that looks like a light version of the UPS brown. And so it's kind of hard to see where the telescoping part starts and the stationary part ends on the bed. So that was one thing. And then there's a component that you can add, or a battery you can add to the hospital bed. That's a 9-volt battery, standard 9-volt. So that allows you to operate it, I guess, like take it down if you lose power. So that's like your emergency power. It's not going to really do much other than the minimal. Thought about getting like a computer UPS, uninterruptible power supply, to be as a backup. That could really, I think, probably operate the bed, not for a long period of time, but just like if I need to get her down in an emergency. Getting her into the wheelchair and in and out of the car was relatively uneventful. I'm not using any of the technique. I'm just picking her up and plopping her in, carefully. But, she's so light now that that's not a big deal for me to do. It's really not wise, because, if I screw up my back, then we're both in trouble. I think that's it. So, peace, guys. Appreciate you listening. Take care.